What's at risk if equitable vaccine access is not prioritized and is not achieved is nothing short of generations of catastrophe. The Biden administration has announced about 110 million doses donated to the global south. 110 million doses is virtually nothing. It's 1% of what the world needs to achieve full vaccination. At least 11 billion doses are required to reach a level of coverage that's needed to crush this pandemic. We've been holding the Biden administration and other powerful high-income country leaders accountable at every turn. And we're still hopeful because we know the capacity in the global south exists to manufacture sufficient supplies of these life-saving commodities. And we know the indigenous expertise exists in countries like Uganda that have responded year after year to pandemic outbreaks, whether that's COVID-19 or Marburg or hemorrhagic fever or Ebola or HIV. There's extraordinary expertise and knowledge in community health systems across sub-Saharan Africa. Unfortunately, literally, those health workers are dying because they're not vaccinated. The communities they seek to treat are dying because they're not vaccinated. Relying on the pharmaceutical industry to commit to setting aside donations of doses to the global south. We know that's already failing. For example, the global COVAX initiative, which is designed to increase equity, has done hardly that. So that nonsense needs to stop. We're calling on him to prioritize massive expansion of vaccine supply globally, starting with mandated technology transfer so that Pfizer is actually forced, Moderna is forced to expand the base of companies that are equipped to roll out millions and millions and millions of doses of these life-saving vaccines across the global south. We know we need 11 billion doses, and that is a production target that is ambitious, but absolutely achievable. What's at risk if equitable vaccine access is not prioritized and is not achieved is nothing short of generations of catastrophe. The Delta variant has to be a wake-up call because what will come next are most likely, if they're permitted, subsequent variants in COVID-19. And at a certain point, there will be less and less robust response to those variants by the vaccines that we have available right now. And that is terrifying. That is a nightmare scenario. The good news is all of us have the power to make change. There's a vaccine for feeling paralyzed in response to this epidemic of medical apartheid. And that vaccine is activism. I'm old enough to know that right now, the global AIDS pandemic is far from over. But I'll say, because of activism, 2 out of 3 people have access to treatment worldwide. Vaccine justice is what's needed. And instead of hoarding lifeboats while people in the global south drown, the world must stand up and break monopolies, ensure urgently that artificial supply scarcity is expanded so there are enough vaccine doses for everyone, and Black and brown communities who have been pushed unfairly, unjustly to the back of the line are actually pulled to the front of the line where they always belonged.